Good.
Okay, good morning. My name is Dr. Deta. I'm going to translate the clinic for today. May I have your name?
I'm Sam.
Okay, Mr. Sam.
Yeah.
Why do you come to this clinic today? Can I know the reason why? Like what's your complaint?
So every time I'm in cold weather, I've noticed that my arm has been like pale, like really bad. And I also feel weakness on the muscles of my arm at that point.
I know that your arms looks quite healthy and we're in a pretty cold environment right now. So, but I will do a checkup for you to see if there's any problem with your blood perfusion, your blood flow, and like some, heart problems potentially. Okay. Okay. So we will start with a peripheral artery examination. I will be inspecting, and also there will be some touching involved in this exam. Do you consent to that?
Yeah, I can say.
Okay, so this examination will not be invasive, so we don't have to worry about that. Alright, so please get comfortable while I wash my hands. Okay, so starting off with the peripheral artery examination. Okay, starting off with the peripheral artery examination, I'll be doing an inspection of your arms and your upper extremity. So starting from the tips of the fingers to the shoulders, maybe slide down first. So this could make it easier. Roll up your sleeves, please, up to the shoulder level so I can see clearly. Yeah, both sides. Let me help you. Okay, so from the tips of the fingers to the shoulders, both sides, you can see that they look fairly normal. So the skin looks elastic, and there's no redness, no darkening or blackness. There's no necrosis. There's no signs of edema, and there could be pitting or non-pitting, depending on the side. There's no pallor, no cyanosis, and there's also appears to be no ulcers. Okay, so next test I'll be doing is the palpation of the pulse, starting with the radial pulse. Okay, so can you place your hand like this? Yeah, like that. I'm gonna start over here. Alright, moving on to the brachial artery pulse. It's a little more medial. Okay, and then the carotid artery pulse on both sides. And finally, the femoral artery. Okay, so I've conducted the palpation of the pulses. They're both symmetrical. There's no irregular rhythm, so everything is normal. Next is the auscultation of your pulse, starting from. Well, we're gonna do the usual spots. Well, minus the arms. Okay. Starting from the carotid arteries. I forgot to mention I'm using the bell surface of the stethoscope, and now the aorta, abdominal aorta. Okay. And then the femoral. Okay, so the result of the auscultation comes out normal. There's no irregular pulse, and they're both symmetrical or the same from both sides. Now I'll do an inspection, or like largely the same test for the lower extremity. Can you please roll up the sleeves of your pants? Okay. So make sure that you can see everything without the pants like pressure in the legs. To start from the inspection, the skin for both sides, bilaterally they appear to be normal, elastic, and there's no redness, no darkening, no signs of edema and ulcers. And moving on to the palpation, we're gonna do the femoral artery again. And then the popliteal artery, we're gonna do both hands on each side of the knee. Next one, other one. And then we're gonna do the dorsal pedis or the dorsal of the foot. Gonna do both at the same time. And then we will do these, the tibialis posterior. Okay, so the palpation of the pulse is all normal, just like before. There's no irregular pulse, and the rhythm is normal and symmetrical. And now we're gonna do the now we're gonna do the Allen test. Can you please sit down? Please put your hands on your knees like this. Yep. And this test would be used to check for the blood flow or the perfusion of the arms or the hands, the palms, using the ulnar and radial artery. So I will. Can you please squeeze with your right hand for now? Okay. So I will press both the ulnar and radial artery, and I will start by letting go of the radial artery. Can you let go of your hand, your palm? Yep. Just like that. So yeah, the perfusion is less than 3 seconds for the radial. So yeah, 3 to 5 seconds. So it's normal. And we will repeat that, but now it's for the ulnar artery. Okay, let go of your grip. Okay, less than 35 seconds, so that's also normal. Moving on to the contralateral side. Grip, please. And then I will let go of the radial. Wait, let go of the grip. Let go of the radial. Okay, so less than 35 seconds, normal. And grip again. Okay, now I'm gonna let go of the ulnar. Wait, let go of the grip. Sorry. Let go of the ulnar and less than 35 seconds, so that's also normal. Okay, so for the final test, I'll be doing the Verdi test. So please lie back down. So for this test, I will lift up the patient's legs up to 90 degrees. Can you please lift your legs just like that? I will assist. This will go on for 2 minutes, and then 2 minutes at fast, where the patient can sit with their legs hanging down. And now I will inspect the perfusion. So for the arterial return, it's less than 10 seconds since it went back to red. That means that the arterial return is normal. For venous return, it will take 15 minutes, so that will take longer. So the test for today is finished, except for one. I will be doing the ABI or ankle brachial index. But I will wash my hands after this, so we can continue to the test. Do you have any questions before we move on?
No questions for now.
Okay. Okay, Mr. Rafa, so now we're going to continue with the ABI or the ankle brachial index. For this test, I'll be checking the blood pressure of both your brachial artery and your ankle to compare the difference or if there's any regularities between the two. If it's the normal value is at a 1-to-1 ratio, so that means that the blood pressure of each area are the exact same. And if it deviates from that, that means there could be some problems regarding either of your arteries. Okay, so I will wash my hands and I'm gonna get the tools for this. Please get comfortable. Okay. Okay, so I have the tools necessary here. I'm gonna first find the brachial artery. Right there it is. Can you please straighten up your arm a little bit? So just like that. Now I will get ready to take the tools. Excuse me. Follow your sleeves a little bit, please. Thank you. Now we'll place this right here. If it's too tight or not tight enough, please tell me. For the stethoscope, I'll be using the diaphragm.
No, bell.
I mean the bell. Perfect.
Release. 120.
Okay, so the systolic blood pressure of your brachial artery or your arm is at 120. 120 millimeter mercury. So that is normal. Now I will move on to the ankle and artery first. Right.
This will be a little bit uncomfortable.
Can you tell me if it's too tight or too loose?
Okay, go.
Okay, so the blood pressure of your ankle is at around 120 millimeter mercury, so it's the exact same as the pressure of blood pressure. So that means that the ratio is around 1 to 1. So that means there is no abnormalities with your blood pressure, so it's all normal. I think you're really nothing. So the
So I'm
other,
healthy now?
yeah, you're perfectly healthy, sir. So do you have any questions?
No questions.
Okay, so if you are still unsure, like after our test, you can come back here. At around 1 week, I will be happy to do more checkups for you.
Okay, thank you.
Yeah, thank you, sir.